we've been discussing all day, when should an individual worry? And is it the amount of alcohol you're drinking? Is it how it affects your relationships, your work? And it's a very personal thing. And that's why I'm very excited about the Sober Curious movement, because it gives someone an outlet if they want to try to stop drinking alcohol without going maybe to the further steps of working with someone like you. When does someone need to start worrying?
The issue is, do you have an incipient problem or do you have a problem that needs treatment, right? And these are two different issues. If you can control it, you better be careful and you better control it, because you're going to lose control. And if you lose control, do you need treatment? If you can't stop on your own, you're going to need some help. Do you need inpatient treatment? Well, inpatient treatment these days is generally reserved for people that are going to have withdrawal. And let's remember, alcohol is the only drug that people commonly use that's a carcinogen, that's toxic to pretty every tissue in our body, and from which the withdrawal is not infrequently fatal. True DTs is a fatal process. So it needs to be managed in a medical setting. So always talk to your doctor, help get an assessment. If you think you're drinking to the point where you could have withdrawal, if you feel shaky in the morning, if you're having a sort of kicker in the morning to ameliorate the withdrawal.
And quickly for people watching, delirium tremens, oftentimes those symptoms don't come on until 48, 72 hours after your last drink. Yep. And that is a medical emergency. So that's why this is important for people to listen to.
And by the same token, alcohol withdrawal seizures separate from DTs can be all the way up to 2 weeks later. And you could be driving and have a withdrawal seizure. Yes. So this is all need for medical management. It's not a trivial issue. We think about alcohol because we all have relationships with alcohol.
And it's legal. So
it's legal.
It's been in our
culture throughout human history. It's a problem. Don't make no mistake about it. It's a very serious drug.
So we were talking earlier about the mommy wine culture.
Yes.
And so obviously the cases you're talking about with serious medical issues.
Yes.
I think most of us listening would consider that really serious, someone who's drinking like a bottle of alcohol a day, right? But oftentimes when we talk about the mommy wine culture, we're talking about a glass or two. So how do people, specifically viewers watching this, know when they've crossed the line? When does this apply to them?
It's not so much about the amount, right? So first, do your own personal assessment. Do I have this genetic history? Am I having consequences? It's really, for me, the relationship with the substance is a problem when there are consequences. It's defined by the consequence, not by the amount consumed. And let's keep in mind, a consequence on my list is medical status. If your doctor is saying, hey, you need to cut down, that's a consequence.
What
you
if
need to
you
really pay
just
attention.
feel like you can't face a social situation without that glass in your hand?
Right.
Like, would you consider that an issue?
I would consider that an issue. I would say, look, if you can't function socially, that's called social anxiety disorder, and you need to go have that looked at and managed. These things, so many of the things that we sort of minimize in our culture are psychiatric syndromes and really have great management, great treatments out there. You should take advantage of that.
But I actually want to address you a little bit, because I think one of the things you just said, which is probably because in your circles it may be very normal to go have a glass of wine. And you said, as opposed to a bottle of wine. There are a lot of people who, in the mommy wine culture, in the male wine culture, where you might have 4 people at dinner and there's 5 bottles of wine that are gone at the end of the night, and that is a normal night. Yes. So but my point is that's eye-opening for a lot of people, because if you a bottle of wine is a fair amount of alcohol, but if you're doing that regularly, it doesn't become a big deal. And I think that's why everyone's perspective on alcohol intake is so different. And we haven't even discussed liver disease, which is on the rise due to alcohol abuse.
Women are 5 times higher risk of getting complications of alcoholic liver disease. They lack an enzyme in their stomach to metabolize it into something less toxic. So they're 5 times more likely to get cirrhosis than men.
And I think I'd say probably 5 times more likely to deny and not come forward